Emergencies happen, it's a fact of life. But knowing basic life support, or BLS, can be the difference between life and death for someone in need. Think of BLS as your superpower, the ability to step in and help during a crisis. Whether it's a heart attack, a near drowning, or simply someone choking, BLS empowers you to act quickly and confidently. You become a vital link in the chain of survival, potentially giving someone a second chance at life. This guide will equip you with the knowledge and skills to handle various emergencies effectively. We'll break down complex procedures into simple, easy-to-follow steps. Remember, you don't have to be a medical professional to make a difference. With BLS, you too can be a hero. Imagine yourself in an emergency situation. Your heart is racing, adrenaline is pumping, but hold on. Before jumping into action, it's crucial to prioritize safety. First and foremost, assess the scene. Are there any potential dangers to yourself or the victim, like fire, traffic, or falling debris? Your safety is paramount. Once you've ensured the environment is safe, approach the victim and check for responsiveness. Gently tap their shoulder and ask loudly, "Are you okay?" If there's no response, it's time to call for help. Shout for assistance, or, if you're alone, dial 911 or your local emergency number immediately. Remember, every second counts in an emergency. With safety addressed and help on the way, it's time to assess the victim's condition. We need to determine if their heart is beating and if they're breathing. First, check for breathing. Look for chest movements. Are they rising and falling? Listen closely for the sound of breaths. Feel for breath against your cheek. If you don't see, hear, or feel any signs of breathing, it's an alarming sign. Next, check for a pulse. Place 2 fingers on the side of the victim's neck, just below the jawline. Feel for a steady thump-thump, that's the carotid artery. If you can't find a pulse within 10 seconds, it likely means their heart isn't pumping effectively. These checks are crucial in determining the next steps of your BLS intervention. If you've determined the victim isn't breathing or has no pulse, it's time to start CPR, cardiopulmonary resuscitation. CPR is a life-saving technique that manually pumps the heart to circulate blood and oxygen throughout the body. First, position the victim on their back on a firm, flat surface. Kneel beside their chest and locate the center of their breastbone. Place the heel of one hand on this spot, interlock your fingers with your other hand, and keep your elbows straight. Now begin chest compressions. Push down hard and fast, at least 2 inches deep, at a rate of 100 to 120 compressions per minute. Think of the beat of the Bee Gees, "Stayin' Alive." That's the rhythm you're aiming for. Continue with cycles of 30 compressions followed by 2 rescue breaths.